Hi, Tom. How are you?
Good. How are you?
Good. It's good to see you. Nice to meet you. We've talked on the phone a couple times, but I know that coming in is so it's nice to meet you face to face.
Sure. Yeah.
Um,
Agreed.
so I understand that your daughter has been abused, and that was kind of a rough situation for you guys. Is that right?
Yeah.
Okay. Okay. And so we kind of talked about that a little bit on the phone, and you kind of explained that to me, and explain the situation. And so I'm sorry that you went through that, and I'm sorry that she's going through that, and I'm here to help you. So something that I like to use is called trauma-focused cognitive behavioral therapy. And so it's going to help you and your child work through this trauma and kind of integrate it into your life so that you don't have to be scarred by it. It's going to be a part of your life, but it doesn't have to define you or her. And you can integrate it into your life so that you can still have it go on and have a successful, happy life. And she can be a happy kid and enjoy her childhood and all that. So I'll tell you a little bit about that, and then we'll go on from there. So there are going to be 8 different components, and so I'll start meeting with her, and I'll start meeting with you separately, and we'll kind of work through some different stuff, and then towards the end, the later sessions will come together, and that will be a way for you to support her and be a successful, build up that relationship, and you guys can communicate, and you can learn about her trauma, and she can have her voice heard, and it might be hard, but working through that, I think, you guys will come out on the other end of this. So I'm going to ask you a couple questions just to learn a little bit more about you and your daughter and what you've gone through. So as we kind of have spoken about, trauma can really have a detrimental effect on someone. And so sometimes that comes out in the way somebody's acting. Maybe they are usually happy and joyful, and all of a sudden they're just really quiet and reserved. Or maybe a kid is just acting out and they just aren't behaving, usually a pretty good kid, or they're just, aren't reacting like they usually do. Or they may just simply not be sleeping well at night, or things like that, or not doing well in school anymore, or not being able to listen. So have you noticed any changes in your daughter since this happened that you are really concerned about?
More quiet, doesn't really talk as much.
Okay.
Not that we, talk all the time, but like it's like a serious conversation, but just quieter. For sure, and then yeah, definitely the acting out too.
Oh,
Just
really?
getting mad really easy and just kind of short with me and sometimes everybody.
Sure. Okay. Before this happened, was she really outgoing? Was she kind of shy, or just kind of an average kid? What was her usual affect like?
Kind of shy,
Okay.
but still outgoing. I mean, pretty, I guess you'd say happy-go-lucky in a way.
Mm-hmm.
But now there's glimpses of that, but nothing like she was.
That's got to be hard as a parent to see her like that.
Yeah, definitely.
Okay. And is there anything that you try and do when she's either acting out or when she's acting really quiet, or how do you handle that as dad?
Sometimes not so well, but yeah. I mean, I just a little bit. Sometimes I give her space, just knowing, because that kind of seems to help, but it doesn't necessarily solve anything.
Give her space. What do you mean by that?
Just, I'll say, please don't say something, or say that, or something like that when she gets mad. Or if I can tell that she's just in a mood. I'll try to give her a space and just not bother. But like I said, I mean, I know that doesn't do much. It doesn't solve the problem or anything. It just kind of lets it go its way,
Yeah.
I guess.
Sure. That's good that you recognize that, though. You're trying, but you may not know exactly how to handle it. So you try a little bit, and then you kind of don't get anywhere, and maybe you just give up. Then is that what you're saying?
Yeah.
Not give up, but just
But
for the time being, and just kind of let her be.
Yeah.
Okay. And you mentioned she's kind of acting out a little bit too.
Mhm.
So are there consequences tied to her acting out, or does she?
No.
Or do you just kind of let it go, since you know
It's kind of tied to that.
yeah.
Just kind of letting it go.
Okay.
I don't know. It's hard.
Do you feel that it's kind of hard to come down on her, knowing that she's been through this, and that? Yeah, that makes sense. It's okay. Sounds like you're trying to be the parent that you can be, and knowing that there's boundaries there around this trauma that's happened, but yet it's that fine dance of like, how do you handle it and help her, but how do you also kind of hold her accountable for her actions and everything?
Yeah.
Okay.
Good.
Well, it sounds like in what I've spoken with your daughter just the one time so far and what you've told me, it sounds like she's definitely has some of the PTSD type symptoms that come with a trauma. I'm sure you're familiar with PTSD, or at least what it stands for, post-traumatic stress syndrome disorder, and just it can come out in many different ways. Like I mentioned, bad sleep, aggression, or anxiety, depression. So all kinds of things. So, and kids especially tend to act abnormally or be aggressive or just not be themselves. So, so one of the first things that I want to do is teach you about trauma and teach your daughter about trauma so that you both understand, oh, this is normal what we're going through. What you're going through and what you're feeling is normal. What she's going through, what she's feeling is normal. And those are all basically reactions to the trauma that's happened. And so, so now that you know a little bit more about the trauma, it sounds like you understand why she's acting the way she is, but you just may not be able to understand how to handle it. Does that sound about right?
That's definitely true.
Okay. So, are there specific things that I can help you work on as far as how do you want to change the way that you handle it?
I don't know. I just want to try to be positive.
Mm-hmm.
With her, and I guess a little bit with myself, because it's I don't know what to do in a way.
Yeah.
And I want to, like, on the acting out part, being quiet and having your own time, that's fine.
Mm-hmm.
But the acting out part, it's like, how do you handle that? Like, because I know I probably should say something, but most often I just don't, because I don't want it to escalate to something else.
Yeah. Yeah.
So I guess I'll say that.
Mm-hmm. That's understandable. Do you ever take the time to just sit down and say, "Hey, you're acting kind of crazy. You seem like you're mad. Can you tell me why you're mad?" And just really kind of just break it down for her and just say, show her, sit her down and just look in her eyes and just be like, "Looks like you're really mad the way you're acting right now," or sad, or even when she's happy. That's a good thing to recognize too, and just say, "You look really happy right now. I'm glad you're happy." That can be simple. Just being able to show her that you recognize how she feels and that she's acting that way. That can mean a lot to somebody, just to know that they're seen, basically. So, okay, so we'll come back to that. But one of the other things that I'm going to be working with your daughter on are relaxation techniques. So a lot of times when the trauma comes up, or when she's reminded of it for one reason or another, we've all done this, like we get tense, or that's when she starts to get angry inside, and then it comes out as aggression or aggressive behavior. So I'm going to be teaching her some ways to just take some deep breaths and just some breathing techniques, and when to notice when her body's kind of starting to do that tightening up thing, or when it's going there. And so it'll be things like deep breathing techniques, muscle relaxation, and
hello, guys. Hello.
Even visual imagery.
Hello.
Okay. Yeah. And so Okay, sorry for the slight disruption. We're back at it. And so those relaxation techniques are something that she can pull on. It's going to be a skill that we're going to build. And even I suggest you say to her, like, hey, what did you learn about that? Teach me some of those. Because if, it's something that she can teach you, or you guys can do it together. And so another thing that I'm going to be going over with her and a little bit with you now is affective expression and regulation. So there are going to be certain things that are going to remind her of the trauma. So it might be a smell, or it might be a dog walking down the street, or something that just triggers her senses and makes her think of the trauma again. And so what we're going to try and do is we're going to recognize those things and be able to identify them and then change that negative thought and feelings into something neutral. So that's going to kind of go along with the relaxation techniques. So when she notices those things, we can teach her to stop, take a deep breath, recognize this isn't the trauma repeating itself, but it's just something that is similar. And so she can recognize it and move on. When she starts to do that, she's going to start to feel a little more confident in herself, more like herself, more in control. And so I think that will help her. And then cognitive coping and processing. So this goes hand in hand with what I was just explaining. So just recognizing those thoughts and feelings, but then being able to change the outcome. Noticing patterns and common denominators that cause those thoughts and feelings, or cause the aggressive behavior, or cause the anxiety or depression to kick in. So we're really just going to kind of pay attention to everything. Just slow everything down and just kind of pay attention to everything that's going on. And then the next stage is really an important part of the process. It's going to be the trauma narrative. So we're going to take it really slow, and when I feel that your daughter is ready, we're going to start talking about what happened. Because it's, some people are going to say, no, don't do that. Keep it quiet and just push it away. But if we do it in the right way and slowly and let her just kind of take her time and tell her story and what happened, it'll be empowering in the end, because she'll be able to tell her side of the story. And it's kind of all about what we say, being seen, heard, and known. So we want her to be, where we want to recognize that trauma and how it affected her. So we might draw pictures about it. We might write about it. We might just talk about it. We might, however it floats for her. So we're just going to kind of take her lead on that. And then along with that, we'll do in vivo exposure. So we'll slowly start to reintegrate reminders of the trauma. So if it is like a certain dog walking down the street, we're going to slowly drive down that street and say, yeah, there's that dog, and he's going to stay in his yard and not race after us. And then eventually, very slowly after we do that several times, we're going to go on a walk down that street. Or, you know what I mean? So it's going to be a very slow, very deliberate, and just kind of a slowly reintegrating those senses so that we can change kind of the thought processes for her. And then at that point, we're going to start bringing you guys together. We're going to have both of you guys sitting here with me, and she'll be able to tell you the story of her trauma, and that's going to be really important. And so on your end, I know I've done a lot of talking so far, but on your end, maybe start thinking about what that's going to feel like to hear the story straight from her, and just let her tell it and let her share her perspective. So let's talk about that for a minute. So as soon as I said that, you kind of took a deep breath and said, whoa, yeah, sounds like that's going to be hard for you. What do you anticipate when I say she's going to tell you about the trauma and tell you everything about what happened?
It'll be hard. It'll make me mad.
Sure.
And so I think it'll be hard. It'll just be hard to hear.
Mm-hmm.
We need to, because I know that needs to happen, eventually, when it's time, when she's ready and stuff. And I know that's possibly going to be a long process. And hopefully by then, with going through all this, we'll have some just realization on our own, both her and I, and so we can kind of work that together. And it's just going to be hard.
Mm-hmm. Mm-hmm. You mentioned you might feel mad when she's telling you the story. What will that anger be directed at? What will you be mad